what about Vas Efferent? A little bit corrected. And Vas Efferent, we said we have alpha-1 adrenergic receptors, but they're not so significant, let's say, like in Vas Efferent, yeah, less significance. Another type of receptors that we have in Vas Efferent is a AT1 receptor. So it is a angiotensin receptors type 1 for angiotensin 2. So AT1 receptors for angiotensin 2. Once again, receptors for angiotensin 2 type 1. Type 1. As we have production of renin, yeah, by juxtaglomerular cells, and we have activation of renin-angiotensin-aldosterone system. The final result, we have synthesis of AT2 angiotensin 2, and this angiotensin 2 acts on this angiotensin type 1 for angiotensin 2 receptor. So stimulation of these receptors causes vasoconstriction. Not only in Vas Efferent in kidneys, but in general in our organism. Yeah, in our organism. So we have vasoconstriction. As a result, we have decreasing in Vas Efferent diameter, glomerular filtration rate rises, renal plasma flow decreases, and filtration fraction also increases. Yeah, maybe it looks like a controversial for activation of sympathetic nervous system and renin releasing, because we have activation in case of fight and flight response, or in response to stress. Yeah, as we're talking about sympathetic nervous system, and let's say bleeding. Yeah, in case of bleeding, we have activation of sympathetic nervous system. We have activation of renin-angiotensin-aldosterone system, and we have releasing of arginine, vasopressin, or antidiuretic hormone, or vasopressin, and it looks like everything should be focused on conserving of fluids, yeah, and maintaining of blood volume. But it happens because due to the constriction of Vas Efferent, we have more osmotically active filtrate, and more reabsorption has happened. So this is the mechanism how it works. Yeah. So we have AT type angiotensin type 1 receptors for angiotensin 2 and Vas Efferent. And what is interesting that we have medications that called angiotensin converted enzyme inhibitors, and we have ARBs, angiotensin receptor blockers. ACE inhibitors and ARBs, they block these receptors. As a result of this blockade, we should understand that diameter of Vas Efferent rises, yeah, increases, and this may cause may cause kidney insufficiency in some individuals, especially with bilateral renal artery stenosis, as kidney unable to maintain glomerular filtration pressure due to that. So administration of ACE inhibitors and ARBs may cause rising in creatinine level also, and usually rising in 15 to 20% from basic level of creatinine is a normal situation with administration of ACE inhibitors and ARBs, and greater rising corresponds to pathological situation.